Bismillah ar-Rahman ar-Rahim. Diagnosis of TB. Radiology. In radiology, tuberculosis is a great mimic and no radiological picture can be characteristic of the disease. And in about 15% of cases, bilateral hilar adenopathy may be present and confused with sarcoidosis. And CT scan findings in tuberculosis are equally non-specific. But chest X-ray is very important tool in diagnosis of TB. Microbiology, smear examination. An important part of TB management is good quality smear microscopy to identify Mycobacterium tuberculosis as acid-fast bacilli. As a smear gives a quantitative estimation of bacilli being excreted, it's so vital in diagnosis, assessment of patient infectiousness, follow the progress of TB patients on chemotherapy. So again, smear examination of the acid-fast bacilli is very important tool in diagnosis of TB and also used in assessment of infectiousness and follow up the progression of the TB progression of the TB patients on chemotherapy. And World Health Organization has strongly recommended sputum smear examination as preferred screening test and suggests examination of the three deeply carved out sputum samples as first, as follow. Day first by spot sample, day two overnight sample, and spot sample in the morning. More than three bacilli on the whole smear are needed to consider the smear positive. Though acid-fast bacilli smear examination is an extremely simple test carried out in most laboratories, it requires dedicated effort to obtain accurate results. Smear examination has the advantage of simplicity, availability, and rapidity, but the sensitivity is affected by the skill and experience of microscopists, the number of specimens examined, proper collection of the sample, the concentration of organisms in the sputum. And smear examination remains the cornerstone of case findings in low income countries. After digestion and decontamination, the specimen examined by Thiel-Nelson, which is hot method, and Kenyon cold method, and the Oramine fluorescence technique. Culture. Culture of Mycobacterium tuberculosis is the gold standard of diagnosis of TB, and the culture can be performed for sputum, bronchoalveolar lavage, gastric lavage, extrapulmonary site aspirates, tissue biopsy collected in saline. What are the advantages of the culture? Advantages of the culture include the following. Culture is much more sensitive than smear examination and can detect 10 to 100 viable mycobacteria per milli of sample. In case of active disease, they are found to be 80% sensitive and 99% specific. It allows specific species identification and testing of drug susceptibility patterns. Media used for cultivation may either be solid media like Levenstein Jensen media or liquid media like Bactic and Middlebrooks 7H10 and 7H9. Bactec Magit 960, which is automated. The Magit system is based on glass tube recently replaced by plastic tube containing 7H9 brought together with a fluorescence-based oxygen sensor. The fully automated version can incubate up to 960 samples for mycobacterium diagnosis. Drug sensitivity or drug susceptibility testing. Culture methods are also required for further drug sensitivity testing in cases of suspected drug